Bore da pawb, croeso I chi gyd. Good morning everyone and welcome to you all. My name is Jan Janczewski and I'd like to welcome you all to the Cardiff and Vale University Health Board's annual general meeting. As chairman, it's a great privilege for me to introduce the annual report and accounts for the years 2020 to 2021. This year, we're once again holding this event virtually, and we really appreciate your time in joining us this morning. It's a little impractical for me to introduce all of my board colleagues through a virtual platform today, but the details are readily available to you in our annual report. However, I would like to introduce three of my fellow board members who will be presenting today. They are Len Richards, if you could just acknowledge Len, our Chief Executive Officer. Yes, Len. Dr. Stuart Walker, who is our Deputy Chief Executive Officer and our Medical Director. Okay, Stuart. Thank you. And Chris Lewis, our Deputy Director of Finance. Okay, Chris. A recording of the AGM will be made available for everyone in due course. I'm sure you'll all agree that this past year has been a year like no other we've ever experienced in the NHS. As a health board, we have faced a huge challenge with the ongoing pandemic, and it's been necessary for us to change and adapt accordingly. As changes continue, and as we're moving forward, I'm able to confirm today that we have started the recruitment process for a new Chief Executive Officer, but more on this a little later. The necessary restrictions on our working and home lives have affected everyone. No one would have thought at the start of 2020 that just 18 months on, we'd have to adapt our personal and work lives significantly and embrace the likes of home working, virtual meetings, social distancing and self-isolation. The impact this has had on us all as individuals is huge, and it has never been more important for us to be kind to each other. Sadly, our communities have been somewhat fractured by the issues around race and equality. As a health board, we are committed to supporting equality and we fully recognise our multicultural and diverse staff and communities. We have worked to develop relationships with our communities and break down any barriers that might restrict access to healthcare. This has been reinforced through our strong partnership working with our local authorities, particularly as part of Test, Trace and Protect and the vaccination programmes. We've worked incredibly closely with our local mosques and the India Centre. We've also signed a memorandum of understanding with the British Association of Physicians of Indian Origin to build on these relationships and provide accessible services for all. Moving forward, we need to take the learning from COVID-19 to ensure that we continue to look after the health and well-being of our population as well as our staff. Our staff are the backbone of the NHS, and as a board, we are incredibly proud of every one of them. Our staff and volunteers have been severely tested and taken out of their comfort zones in ways they could never have imagined possible, and they have responded brilliantly. We have seen staff redeployed to other unfamiliar areas to support the needs of our patients. Staff have adapted superbly to new ways of working and supporting patient care, including the evolution of virtual consultations, which has helped in both primary and secondary care settings. Our staff have also been involved in a number of clinical trials set up to investigate and source ways to treat and manage COVID and the vaccination programme, all with the aim of providing the best care and treatments for our patients. Perhaps on behalf of the board, I could pass on my sincere thanks to all of our staff for their amazing work and the compassionate and high quality care they continue to provide to our patients. I cannot forget the incredible contributions made by our communities, partners and other organisations during this time. From the contractors and tradespeople who helped us to deliver 2 surge hospital facilities in a very short space of time, to our local authorities who have supported in a number of ways, including the Test, Trace and Protect work, to the military and third sector organisations that provided strong support, also in a variety of ways, including our mass vaccination efforts. Your support was so much appreciated throughout the year. Thank you. It was heartwarming to see the people's support while our staff were on the battle line, as it were, with the colourful rainbow pictures, the donations of supplies for our staff and patients, and the support from local businesses to feed our staff. The recent award from the Queen of the George Cross to all NHS staff is one of the highest honours and an exceptional commendation, which is thoroughly deserved by each and every one of you. As we start to move forward and restrictions are carefully lifted, it's still important for us to stay safe, look after each other and protect our NHS. I mentioned a little earlier that we will be replacing our Chief Executive Officer, Len Richards, who is leaving us at the end of September. I'd like to take this opportunity to say thank you to Len who over the last 4 years has provided strong and compassionate leadership to the Health Board. He has been a strong advocate of providing the best possible patient care and maintaining staff well-being, as well as supporting innovation and research in healthcare. This is definitely a legacy we wish to continue. I'm sure you will all join me in wishing Len well in his next role. We do wish you well, Len. Thank you for your work. If I can move us perhaps now to the next item on the agenda, which is apologies for absence. Nikki, do we have any apologies, please?
We do, Chair. So we've got apologies from Catherine Phillips, David Thomas, Michael Imperato and Susan Elsmore.
Thank you very much. Okay, we're moving now on to the minutes of the meeting held on the 24th of September 2020, which seems like a long time ago now. Are we all content that these minutes are accurate and a true reflection of that meeting held on the 24th of September 2020? I see a lot of nods around the room, so we'll take that as confirmed. Thank you. The next item on the agenda is our annual report for 2020-21, including the highlights. And I'd like to introduce once again Len Richards, our Chief Executive Officer, and hand over to Len to do his presentation on the report. Len, over to you, please.
Thank you, Jan. And Raj, could you put the first slide up, please?
Yeah, just a moment.
Yeah, thank you. So I'd also would like to extend a warm welcome to everyone online at the annual general meeting today. It is with mixed emotions I'm speaking to you virtually and not in person, as this will be my last formal board meeting and annual general meeting as Chief Exec of Cardiff and Vale University Health Board. As many of you know, I'll be stepping down to take up a new position as Chief Executive of the Mid Yorkshire Hospitals NHS Trust. And at the end of September, I'll be handing over the reins to Professor Stuart Walker, while the new Chief Exec for Cardiff and Vale is sought. And I wish Stuart the very best, all the very best. And I know I'm leaving the organisation in really good hands. So while I'm sad to be leaving Cardiff and Vale at a time with so many exciting initiatives and programmes of work taking place, I'm pleased and proud to share with you some of the key areas from the last year. But if you would also indulge me on the occasion of my last AGM, I'd like to share with you some of my personal highlights and things that I've been particularly proud of over the 4 years of my time here. So firstly, down to business. If you can, Raj, if you can do the next slide. As Jan said, this is a year like no other. In March this year, we did a look back over the 1-year anniversary since the first lockdown took place, was announced on the 23rd of March 2020. As a result of COVID-19, our staff have had to continuously adapt, review and reform to enable us to cope with the challenges of dealing with COVID-19. Clinically, our ICU have borne the brunt of dealing with our most sickest patients. They've worked long hours in PPE, personal protective equipment, and they've sadly carried the emotional scars of dealing with so many patients dying in their care and handling their families at some of the worst times imaginable. But they've done this professionally and with dignity. Many of them at the same time dealing with colleagues, and I would like to formally put on record our deepest sympathies at losing a number of our colleagues to COVID-19. But during this time, our staff have managed to be innovative, using research and development trials to support the development of vaccines and learning from clinical evaluation to support the future care of patients, some of whom are sadly still dealing with the after effects of the now well-used term long COVID. We have much to be proud of in the way in which the organisation stepped up to the challenges that the global pandemic threw at us. A world-class record track, trace and protect service, and again a world-class vaccination programme led by our public health team and our partners at the local authority has seen us give out over 700,000 vaccinations, which equates to 92% of the adult population receiving their first dose and 79% receiving both both doses, a truly remarkable feat and one of the world's largest vaccination programs. If we can go to the next slide, please, Raj. So our performance as a health board is documented in this year's annual report. As you'll be aware, COVID-19 has had a significant impact upon our ability to deliver as a health board. And in March 2020, the IMTP process was paused with Welsh Government, and we introduced quarterly frameworks and an annual plan. As part of our response to COVID-19, we changed our operating model for the period with the overarching principle that we would always be COVID ready. This period has seen us shift our focus to areas of priority across the first, second and third waves, such as increased infection prevention and control, additional capacity at the Dragon Heart Hospital and then the Lakeside Wing, and indeed across all of our hospital sites. The support from primary care, the community and pragmatic staffing solutions ensured we could still provide safe, effective and quality services. Throughout this period, some areas experienced extreme pressure and demand on their services, and in other areas, they were able to adapt to support where the demand was focused. I'm pleased to say that during this period, we were one of the few health boards in Wales continuing with routine and emergency cancer services with treatment levels at 90% of their pre-COVID level. And our compliance against the single cancer pathway has ranged between 54% and 81%. We set up protected elective surgical units to maintain our theatre operating, set up dedicated green and amber zones on both of our acute hospital sites, which I'm pleased to say have a 100% record of successful surgery with no patients acquiring COVID. We diversified to introduce video consultations and virtual clinics. In mental health, we provided more specialist and targeted services, focusing on intervention in primary care. The Attend Anywhere video consultations had the highest number of service users across all of the health boards. We also introduced CAV 24/7, a new and innovative approach to how patients access urgent care by encouraging a phone first system, which averages around 180 phone calls per day. The number of patients currently attending our emergency unit continues to increase, placing the system under significant pressure akin to our winter months. But throughout the period of the annual report, we initially saw a decrease with 106,000 patients attending EU compared to 150,000 in the previous year, 2019-20. Despite this, we've made significant strides on our performance and delivery, all of which are detailed in the annual report. And you'll see a short video, a year in review, towards the end of this annual general meeting. In terms of service challenges, as a UHB, we've been predicated by the global pandemic in terms of staffing, infection prevention and control, access to services with COVID restrictions in place, access to equipment as we came out of Brexit, plus shifting priorities in line with the national guidance. Wherever possible, we've sought to safely maintain essential and non-essential services. While we maintained access to urgency and emergency surgery via our PESU, our Protected Elective Surgical Unit, with over 10,000 operations undertaken and a much reduced cancellation rate, we recognise the significant backlog via the Reset and Recovery programme, which means there is a lot more to do. We've continued to work with the independent sector to reduce waitlist times. We've maximised endoscopy insourcing, seen over 10,000 patients using our mobile MRI scanner, outsourced ophthalmology patients, breast cancer patients and clinical haematology patients, all based upon clinical urgency. However, we are mindful of the volume of patients waiting for diagnostics, follow-up appointments and referrals, and this will remain a challenge to all of us going forward. The pressure across the system remain, particularly in mental health, with an unprecedented demand upon service levels. Primary care and clinical diagnostics are also enduring unprecedented levels of demand. Our reset and recovery plan has a clear set of objectives and a way forward for how we will continue to tackle these issues while still coexisting with COVID-19. It's easy to think of merely the clinical services response to the pandemic, but the service boards, specialist departments and general support services, which include capital estates and facilities, procurement, digital and IT, workforce and communications, to name but a few, have all played a vital role ensuring our services remain safe and effective as possible. All of these areas are feeling the strain on their service, but remain COVID ready and willing to remain proactive alongside doctors, nurses, allied health professionals, scientists and lab technicians, and all of our clinical teams. In terms of staff, the NHS has been at full stretch since the early days of the pandemic. When we first saw the images emerging from Italy, we knew the scale of the task ahead of us, and as Jan has already referenced in his opening comments, our staff have been exceptional. Sadly, as I mentioned earlier, we lost a number of our own staff, and for many others, they've been dealing with the grief of losing close family members and friends, and in some cases, grieving their patients' deaths as well. Our staff have adapted remarkably to the global pandemic, taking on roles outside of their normal areas of practice. But we recognise the impact this has had on many of our frontline staff in particular. We've responded with our employee wellbeing service that provides around-the-clock support through a range of tools and therapies to support staff. We haven't always got this right, particularly in the early days of the pandemic, but we are continuously looking to develop this service, especially as the longer-term impacts of dealing with the pandemic and symptoms of long COVID become better known. Our staff are at the heart of the NHS, and their willingness to adapt alongside their goodwill has been outstanding. There are not many areas of business that could have coped with the sustained levels of pressure and with the resilience and fortitude that they have shown. I'm humbled every day by letters of thanks, a story of loss, or how we've tenaciously sought to find a solution to a treatment plan or a discovery in research or medicine to prevent or curtail a virus that this terrible disease has brought to us. I very often profile these fantastic achievements in my weekly Chief Exec Connects. I would like to thank each and every member of staff who diligently comes to work to perform their duties, whatever role, clinical or non-clinical. Everyone has a role and a contribution in caring for our population and keeping them well. As a health board, we will continue to listen to, support and work with our staff to ensure that we can continue to face the next NHS and health challenges together. Can we go to the next slide, please, Raj? So in terms of engaging with our communities, one of the real positives to come out of COVID is our relationship and engagement with the public. Over the past year, and indeed since the start of the pandemic, the support from the public has been extraordinary. From the rainbows to the food parcels, to the gifts, to the letters of support, the Thursday evening clap for key workers. It has been very much appreciated, and I know from speaking to our staff in some of their darkest moments, it is this support that has kept them going. Again, many of these stories have been documented in our annual report and across our social media channels. But on behalf of the Health Board, I would like to thank the community of Cardiff and Vale, and indeed the wider population of Wales, for their unrelenting support of our staff at Team CAV over the past year. So on to priorities and the future. Like society as a whole, none of us know what the future will bring in terms of the pandemic, But what we do know is that our planning and preparedness for responding is better than ever before. We know more and have taken a lot of learning from the past year. We have a robust reset and recovery plan in place. We have our annual plan approved by Welsh Government, and we also have our strategy shaping our future well-being with its programmes of work to help us shape our services and support delivery of health services across Cardiff and Vale. Stuart will talk a bit more about this, but we also will be setting our priorities alongside the ministerial priorities established by Welsh Government a few weeks ago to support recovery in Wales, but also to build on many of the positives that have come out of the last year. It really is an impossible task to demonstrate all of the incredible work that has gone on over the past 12 months, but hopefully this has given you a snapshot of the key points, which I'd be happy to take questions on at the end. But can we move on to the next slide, please, Raj? But before I take any questions, I wanted to take just a few moments more to share with you some of the incredible highlights of my time as Chief Executive of Cardiff and Vale. Again, an impossible task to convey everything, but from the first moment I walked into the Cochrane building on the Heath Hospital site as part of the interview process, I knew that this was a special place where people got things done. I was appointed by the previous chair, Maria Battle, and have been fortunate to work with Jan, both inspirational, supportive and ambitious in their plans for the population of Cardiff and Vale. My colleagues in the executive team, specialist in their particular areas, always willing to go the extra mile and to do the right thing to get things done, and fantastic partners who've worked with us to help us achieve, like getting us out of targeted intervention, achieving financial balance, to building the Dragon Heart Hospital, all seemingly impossible, but all delivered over the past 4 years. On this slide, I've just put up a few things that actually resonate with me over the 4 years. So I'll just pick out some, and I've got a couple more slides that we can add to. So the Wales Gender Service, a brand new service, much needed in Wales. Our patients were having to travel to London to access a service prior to us establishing the specialist centre here within Cardiff and Vale. The mass vaccination programme, I've already talked about that, but leading in the world the vaccination of our population. The Major Trauma Centre, a fantastic development for us here within Cardiff and Vale as part of a major trauma network that covers the whole of the South Wales population. And then we celebrated during the year the 70 years of the NHS, an institution that we are all so very proud to be a part of. And I'm sure, and as Jan referenced earlier, the George Cross to all NHS members of staff, I think, is a fitting accolade to be provided. Can we just go to the next slide, please? The recovery trial, an area that research, the delivery of research through COVID was an area that we excelled in, and the recovery trial led to some of the first treatments available to respond to COVID-19, and we were the best recruiter of patients to that trial across the UK. That is something that really contributed to the delivery of services across the whole of the UK. And then just below that, the world's largest ICU oxygen trial being delivered out of the Heath Hospital. Something as well, top right hand corner, the arts programme collaboration with Nathan Wyburn, someone who is talented beyond belief. But those three pictures that are referenced in that slide, I think are the most iconic pictures that I've seen that really sum up the approach and the way in which our staff have faced into the pandemic. And the CAV rehabilitation model revised completely to ensure that we bring rehabilitation to patients in their communities where possible, so that people have easy access to rehab and reablement, so that they can get back to their best selves following disease or treatment. And can we move on to the last slide, please, Raj? And just some of the things: the Joint Research Office, established between ourselves and Cardiff University to maximise our ability to contribute to research across all of the services that we provide. Rookwood, the relocation of Rookwood onto the University Hospital of Llandoxai, creating a real specialist centre for rehabilitation. Next spikes on prescription, again thinking out of the box around how we can actually use community assets and community resources to bring to help respond to some of the needs that patients present with in terms of loneliness, in terms of a requirement for exercise or treating obesity and things like that. So really trying to challenge the causes of ill health. And then my last part of the slide would be the wedding on ITU of Leslie and Roy, something that happened a couple of years ago, but staff went out of their way to arrange a wedding that took place on the ITU so that Leslie and Roy could be married. Again, just a real example of our staff going above and beyond, and they did that through their own initiative. There was no request for staff higher up in the organisation to enable that to happen. Our staff just got onto that, saw a need, responded to it, and really made the day and some memories for Leslie and Roy going forward. So real accolade to the initiative that our staff showed. So it is our staff, it is the people that you've worked with and the patient stories that you remember and take with you, sometimes with lessons learned attached to them. The continued success of the Health Board is a credit to the board and the staff who work here. I've had an incredible 4 years at Cardiff and Vale, and have made some lifelong friendships from here and with our Antipodean friends in New Zealand, who we partnered with over the course of the last 4 years. I've been immensely proud to have worked for the NHS in Wales and here at one of the leading health boards. I would like to thank you all for the opportunities and the support that you've given me and Jackie, my wife, during this time, and wish you all the very best for the future. Thank you.
Thank you very much, Len. And typical of the modesty and humility of Len, our Chief Executive Officer, he didn't actually draw any attention to the fact that he achieved some recognition in the CEO Today magazine, which I know Len will recognise not only as a tribute to the work he's done during his 4 years at the Health Board, but also to the team around him who have supported Len in his efforts to move the organisation forward. It's also a very positive reflection on all of our staff who contribute every day to the work of the organisation. So well done, Len, and thank you.
Thank you. Yeah.
I'd like us to move us on to our annual accounts before fielding any questions, please, if that's okay. So I'd like to invite Chris Lewis, the Deputy Director of Finance, to deliver a presentation to us covering the accounts for 2021. Chris.
Thank you, Chair. If you just give me a second to upload it. Just bear with me.
You having troubles there, Chris? We can't see the presentation yet.
It should be coming up just about now. Can you tell me if you can see it?
I will. Here we go, Chris. It's there now.
Okay. Thank you. I'm Chris Lewis. I'm Deputy Director of Finance. I'm pleased to have the opportunity to present on the financial accounts for 2020-21. I have a short presentation. I'm intending picking up on the key performance issues and income and expenditure areas. I would like to do just to start off by looking at our income and expenditure for the year. Starting off with our annual income, there's a pie chart there which shows that we had income in the year of £1.683 billion. As you'd expect, most of our income comes from Welsh Government in the form of allocations. But as you can also see, we had significant other elements of income. Another big income source for us was from Welsh Health Specialist Services Commission, where we provide specialist and regional services to South East and South Wales. Some of our biggest areas there include neurosciences, specialist children's services, cardiothoracic services, renal services and genetics. We also provide secondary care services to our neighbouring health boards, where we have significant patient and financial flows from Aneurin Bevan and Cwm Taf Morgannwg health boards. And we also provide a significant amount of training, education and research, with most of that income there coming in to support junior doctor training and the provision of undergraduate teaching as well. With regard to our expenditure in the year was £1.683 billion. And as you can see from the top, and this may come as a little bit of a surprise to you, our staffing comes to 45% of our total expenditure, being an integrated health board. We've got secondary care drug costs of £109 million. In addition to that, within primary healthcare services, we've got a further £81 million on prescribing, and we spent £147 million on contractor services such as GPs and dentists, £62 million on continuing healthcare. But we also, as a Commissioner of Services, get services commissioned for our residents from other providers. The vast majority of that £138 million was via WISC, with most of the rest being Welsh NHS trusts and Welsh health boards. And finally, at the bottom there, other hospital and community expenditure of £275 million, the biggest elements being clinical supplies, premises costs and depreciation. Just a quick snapshot of staffing numbers, really. This was our staffing on the 31st of March 2021. Probably comes as no surprise that nursing makes up 43% of our workforce, and as you can see there, the majority of our staff are patient-facing. Turning on to sort of financial performance. The Welsh Government amended the financial performance duties applicable to health boards in 2014-15. Two duties now apply. The duty to ensure that our spending does not exceed the aggregate funding allocated to us over 3 financial years, that's known as Section 1. And the duty to prepare and get approved a plan which achieves Section 1 was improving the health and the provision of health to the population for which we serve, which is the residents of Cardiff and Vale Glamorgan, and that's known as Section 2. With regard to Section 2, the LHB had an approved plan for the period 1920 to 2021. But due to the pandemic, the planning process was paused in March 20, and the quarterly planning process was put in place for the year 2020-21. But as the approval process was not completed, the approval status remained extant, and therefore the UHB achieved its financial duty under Section 2, which is having an approved plan. With regard to Section 1 for revenue expenditure, the LHB had a surplus of £90,000 against its revenue resource allocation in 2020-21, and therefore it achieved in-year balance. This, however, formed part of an accumulated deficit over the 3-year period of £9.7 million, and hence the UHB did not achieve a statutory duty under Section 1, and therefore, taken together, did not achieve a statutory duty on revenue expenditure overall. And what is shown there is an extract from an annual report on accounts over the 3-year period. This shows the significant improvement in recent times, where we've delivered in-year balance over the last 2 financial years. And if you did go back over a few years prior to that, the UHB had a financial position which was hovering around a £30 million deficit. So we've made significant financial improvements over this period. Moving on to capital, and in addition to financial duties and revenue, the Health Board must contain its capital expenditure within its capital resource allocation of the same 3-year period. In 2020-21, the Health Board spent £104 million, £104,000 below its capital allocation, and the aggregate over the 3-year period was £267,000 less than the capital allocation over that period. And again, there's an extract from our annual report and accounts just to show our performance over those 3 years. So we achieved our statutory duty with regards to capital expenditure. Just to provide a little bit more information on capital, the Health Board spent £95.3 million on capital last financial year, and I've highlighted there the highest areas of expenditure. £33.2 million on research capacity at UHW, £11 million on upgrading and maintaining the estate, £10.9 million medical equipment, £6.3 million on the high consequence infectious disease unit, £5.2 million CRI links, and listed there as some of the other high expenditure areas. Moving forward, if I can, just like to spend a little bit of time just looking at the financial outlook for 2021-22. Unfortunately, the pandemic impacted upon the UHB's ability to deliver the required recurrent savings in 2021 to meet the cost of inflation and demand growth. We were £21.3 million short, and the UHB has been told that we can assume this funding non-recurrently in 21-22, and we are grateful to Welsh Government for providing this support to the UHB. The UHB has also been told to assume funding to meet the ongoing challenges of COVID-19 response costs. These are £176 million in 2021, and as forecast at month 2, they are nearly £94 million for 21-22. In addition, the UHB has already been successful in securing £13.7 million for COVID-19 service recovery, with a further £23.6 million being requested by Welsh Government, and this bid is still under consideration, and we're still waiting for feedback on that response. Okay. Now, the normal planning process remains paused, and as requested by Welsh Government, we have submitted a 1-year operational plan for their approval. This plan sets out the UHB ongoing response to COVID-19 service recovery proposals, as well as other developments to meet national and local priorities. Following guidance from Welsh Government and the resource planning assumptions, we have put forward a balanced plan for 2021-22. On capital, as at month 3, we've got a confirmed capital allocation of £33.9 million, the largest elements being our discretionary allocation of £14.9 million, £9.8 million for Malva Wellbeing Hub, and £6.4 million for national programmes. We will be making further funding requests into Welsh Government to support our COVID-19 recovery plans and other strategic priorities. And what we would do, we'd expect to see our capital allocations rise as the year progresses. Okay, just some final reflections on UHB finances and our financial performance. 2020-21 was an extremely challenging year, having to manage through the service and financial uncertainties of the pandemic. We received substantial additional funding provided by Welsh Government to support our response to the pandemic, being £176 million revenue and £53 million capital, and we're grateful to Welsh Government for the funding which we received for that. The UHB achieved a successful conclusion to its financial year within your break-even positions on both revenue and capital, where significant financial resources were carefully managed. And just to note that the delivery of our UHB financial plan in 21-22, which as Jess said is a break-even plan, will allow the UHB to achieve a statutory 3-year break-even duty on revenue expenditure for the first time since the implementation of the Finance Act. And that's a conclusion, Chair.
Thank you very much, Chris, and thanks for the comprehensive report delivered in such a concise and effective way. Following on from Len and Chris's report, you'll understand the complexity of Cardiff and Vale University Health Board and the work we do, and how seriously we try to look after the public finances that are allocated to us in our efforts to deliver the best quality service we can to our patients. So I'm grateful to both of you for your presentations. Do we have any questions, Nikki, in advance of the meeting from members of the public on either the report or the financial status?
Yes, Chair, through you, I've got 3 questions, so if we take them one at a time. So first, a nice easy question for Len. What will you miss most, Len, about Cardiff and Vale?
Yeah, thank you for that. So it's obvious to me, very easy answer. It's the staff. I've loved being here every minute of the day, and the reason for that is the willingness, the professionalism, the enthusiasm that our staff on the front line, but also through our support departments, give us every single day in the most challenging of circumstances. So that's what I will miss.
Next one, Nikki.
Okay, so how does the Health Board plan to become carbon neutral by 2030?
Do you want me to answer that, Jan? Or?
You can, or you can bring Abby in if you want to,
Abby.
Elaine.
Yeah, Abby would be better. Abby,
are you there?
I am indeed. Sorry, apologies. I've got my camera off because I haven't quite got my home working at the moment. So, thank you for that. We as colleagues will know, and members of the public will probably know, we acknowledged the climate emergency back in January 2020. It seems a very long time ago now. And on the back of that, we've published a sustainability action plan. Since the Welsh Government published the decarbonisation plan more recently, we are in the process of revisiting our carbon neutral plan. And I think it is fair to say we are going to have to stretch some of the actions that we take. There are some big challenges for us. Our estate does not help us in terms of being carbon neutral, with very old buildings that are not particularly energy efficient. Some of them, that is a big challenge to us. But actually, despite that, we benchmark pretty well in terms of our energy utilisation on the All Wales pictures. So we do have an action plan. We're going to update it. There are a range of actions which relate to our energy use, relates to really promoting sustainable travel, looking at how we manage our waste, really making sure that we do everything we can to ensure our waste doesn't go into landfill, that it's recycled, reused where we can. We've got a whole programme around biodiversity to make sure that the green spaces that we manage are managed in a way that really promotes biodiversity. So things like our orchard, things like we don't cut our grass every week. We allow pollinating plants to grow. And actually, the Wellbeing of Future Generations Commissioner recently used some really nice case studies from the Health Board in relation to our biodiversity plan. So we've got a separate biodiversity plan. And it's also about how we deliver clinical practice. So as we've seen during the pandemic, people do not need to come to hospital for every single interaction they have with us. That will help us reduce the cars on the road and the number of journeys that people need to make. Our clinicians are right at the forefront of this. So whether that's the kind of medical gases we're using, how they can improve clinical practice, looking at things like theatres where we have very high energy use and resource use. We've got a green theatre project running through our kind of innovation work stream. And we've got a very proactive clinical workforce. We've got clinical champions. We want to create clinical fellows that are given dedicated time to really focus on this. And our clinicians led the launch of Green Health Wales that Andrew Goodall launched probably 6 weeks ago now. I think time flies. But again, we've got great schemes, and we've had a clinical leadership fellow really focusing on this, Amarantha, in the last year. So I think we're in a good position, but I think we should not be complacent at all. And I think we have got more to do, and we will bring that back to the board. I think Chair, we're due to bring that back in November. So that'll be a year since we produced the initial action plan. We'll update on that and we'll refresh. And I will be asking the board to commit to us really stretching ourselves to go further and faster in respect of this.
Thank you, Abby, very much. A very comprehensive answer. And it's an area we do take very seriously. We are determined to reduce our carbon footprint as much as we possibly can. Nikki, next question. There were 3 you said.
Yeah, this is the third question, so it's probably one for Steve Curry, I would think. How will you work through the outpatient backlog that has grown during the pandemic?
Thank you, Nikki. Do you want to come in, Steve?
Thank you, Nikki. Yes, that is a real challenge and in fact an opportunity for us going forward in terms of outpatients. It is one area where We have seen significant growth in backlog and growth in wait for patients accessing it. But it's also an area where we've seen our clinical teams come together in a remarkable way over COVID to find innovative ways to carry out outpatients appointments going forward, and the virtual use and digital opportunities is a significant opportunity for us going forward, working with clinical teams to find new methods and new ways of undertaking outpatients appointments. And not only is this probably a necessity in terms of going forward, but it's also a great opportunity in terms of how we better meet the needs of patients. Very often the attending a hospital appointment requires quite a bit of effort, particularly for some families and certainly for some elderly people attending appointments. And this is an opportunity for us to change how we do that going forward. So it will be a combination of us building back up our outpatient capacity that we do need to put back in place, and we're already at about 81% of that as we stand, but it will also about using this as an opportunity to change how we deliver services to continue to meet the needs of patients in terms of outpatient appointments, but to do that in a way that is more convenient for them and uses our scarce clinical resource in the best possible way. So it's a key element on challenge for us, both in terms of recovering, but also in terms of transforming our services going forward. Good question.
Thank you, Steve, and hopefully a helpful answer as well. Appreciate that. Nikki, those are the questions from the public. Are there any other questions, please? Okay, I know as a board we talk about these issues on a very regular basis. So if you don't mind, then I'd like to move on to how we adopt the annual report and accounts for 2021. And do I have a proposer, please, that we adopt the accounts? I can see Len nodding his head. Len has proposed. Yep. And I need a seconder, please. John Union. Thank you, John. And could I ask the whole board now to adopt the annual report and accounts for 2020-2021? Yes, lots of nods. Thank you all very much indeed. We're going to now move on to perhaps a bit more light entertainment in a way. We're going to share with you all a video of the Health Board's achievements during the last year. And this has been pulled together by our communications team, so I'm very grateful for the efforts you put into this. But Raj, I think you're going to press the button to start the video, and we have our fingers crossed that it'll work. Raj.
Yeah, but you know.
Do you have any sound with that, Raj? We've lost the video now, Raj. Here we go. Thank you, Raj.
We spend around 1.4 billion every year on providing our communities with a range of health and wellbeing services.
15,000 staff who consistently deliver high quality services to all of our patients.
We care for a population of over 500,000 people.
Shaping Our Future Wellbeing is the 10-year strategy to achieve joined up care based upon a home first approach.
We aim to empower Cardiff and Vale of Glamorgan citizens to feel responsible for their own health.
The COVID pandemic brought some challenges.
Over 300 additional beds were repurposed on existing sites for COVID-19 patients. We expanded critical care capacity to 85 beds, a 124% increase.
We built a 400-bed temporary surge facility, the Lakeside Wing, with the first patient admitted on the 27th of December 2020.
We designed and developed a 1,500-bed surge facility, Ysbyty Calon y Drag, Dragon's Heart Hospital, with the first patient admitted on the 28th of April 2020.
We developed protective elective surgical units, green zones, to continue surgeries. Nearly 5,000 operations were undertaken in 9 months in these areas.
We partnered with healthcare providers to continue urgent services.
10,074 patients were seen and treated in Spire Health from April to December 2020.
Over 90% of outpatients seen at Cardiff Spire were for urgent ophthalmology treatments, clinical haematology and breast cancer patients.
We maintained access to urgent and emergency essential services, including urgent and emergency surgery, eye care, cancer treatments, unscheduled care and mental health.
Attend Anywhere delivered over 15,000 virtual consultations, which prevented over 150,000 miles of travel to hospitals for our patients and avoided around 41 tonnes of CO2 emissions.
First health board in Wales to introduce the new phone first triage system to the emergency unit, CAV 24/7.
Launched Keeping Me Well, the Cardiff and Vale COVID-19 rehabilitation model, which identifies the rehabilitation needs of people recovering from COVID-19 and those whose rehabilitation has been interrupted as a result of the pandemic.
First health board in the UK to open a recovery trial where dexamethasone was found to improve survival of COVID-19.
Launched the Stay Steady virtual clinics to provide early intervention to individuals who are worried about falling or are a little unsteady on their feet.
Advanced Therapies Wales programme officially launched its service to the public in August.
Cardiff and Vale Recovery College was launched, and in 2 terms Recovery College delivered 30 courses, had 641 enrolment and completed 217 hours of teaching.
We signed a memorandum of understanding with the British Associations of Physicians of Indian origin.
We took part in the world's largest Icu Oxygen Trial, looking at how patients are treated with oxygen in intensive care units.
We engaged with our partners and community for the shaping of our future clinical services and the development of UHW2.
TTP services in Cardiff and the Vale of Glamorgan were set up as a part of the response to the COVID-19 in partnership with our local authorities.
The contact tracing service for Cardiff and the Vale of Glamorgan is hosted by Cardiff Council on behalf of the partnership.
Local testing capacity was increased to offer the same-day PCR testing for anybody who requires it.
Drive-through, walk-through and mobile testing sites were established and over 95% of test results are received within 24 hours.
Regular lateral flow device testing has also been established in care homes, schools and hospitals.
During the period 1st of April 2020 to the 31st of March 2021, we received 3,210 concerns and our concerns team implemented the 7-day working model to facilitate communication between wards and relatives.
The patient experience team have supported virtual visiting so patients can connect with family and friends.
Having declared a climate emergency in January 2020, the Health Board has developed an ambitious sustainability action plan. We signed the Vale Climate Charter and joined the Global Green Healthy Hospital Network.
Launched the Meddwl Cymraeg Think Welsh campaign.
Our mass vaccination centre in Splot was one of the first in the world to deliver the COVID vaccine.
Working in collaboration with our partners, we have developed plans to vaccinate the following groups: homeless people, travellers, asylum seekers, Black, Asian or minority ethnic communities, carers, people with sensory loss, transgender communities, people with some mental health conditions, sex workers.
At each mass vaccination centre, we have tablets in place to provide audio versions of leaflets in all languages, BSL interpretation and 24-hour language line access to interpreters for all language requirements.
We provided easy read information in multiple languages to place in local retail and places of multi-faith worship in local communities.
As we move into younger cohorts, we recognise the need to identify social influencers and be mindful of the messages about protection of others. We launched TikTok to help achieve this.
We have now offered vaccines to all of our adult population over 18.
Thank you to our staff, our population and our partners. Together, we have achieved so much.
Thank you, Raj, very much. And hopefully that will give everybody just an insight into some of the achievements that the Health Board has delivered over the last 12 months. Of course, there are many other areas where we've achieved significant bits of ambition for our Health Board and terrific contributions from our members of staff. So thank you for that. I'm going to move us forward now to our COVID-19 recovery and the look forward, which Dr. Stuart Walker, our Deputy Chief Executive Officer and Medical Director, will lead us through. And as Len referred to earlier on, Stuart is going to be our Interim Chief Executive Officer from the 1st of October. And also, as Len suggested, we have every confidence in Stuart as a board that he will look after the organisation pending the appointment of a permanent CEO in due course. Stuart, over to you.
Thank you, Jan. What I'll try and do is not reiterate, in the interest of time, too many of the messages which have already come across. Raj, would you mind putting the slides up? Look, I think we all look back and recognise that the year we've had has been unheralded. It's certainly in my lifetime in the NHS, and I think probably in any of ours. The year ahead is going to be difficult too. But we recognise the challenges that we need to face. We know that we have a workforce that is tired, but we have resilience in our leadership. We are making plans to address the challenges that we're facing, and we have mitigations in place to deal with those challenges. And so I just wanted to run through some of those to give people some of that assurance about where we're heading, that we are on track, and that we have the team to deliver. And so if we could go to the next slide, please. Going through the challenges, of course, reset and recovery. We know that we have a backlog on our waiting list of nearly 100,000 people, 35,000 of which are over the 35-week wait mark. We know that number has been going up this year. As Steve's already said, we have around 80% or so of our outpatient capacity running. Now that benchmarks incredibly well. You know, with the post-COVID IPC rules in place and the workforce challenges we face, as a health board, we are delivering really well on that benchmark of 80%. But clearly that is a reduction on our previous capacity. We know we can continue to deliver on our strategy, and I'll come back to our strategy in a short time. To deliver these, we've got enablers that have to be in place. David Thomas and his team are leading on a very ambitious digital transformation strategy. As Len's alluded to, we are leading, I think, in Wales in terms of our adoption of innovative technology. Certainly, we have an aspiration in terms of being an absolute leader in that regard, and we have developed the world's class Dragon's Heart Institute this year. Finally, of course, and I will come back to this, most of this is about our staff, and we know that our staff have performed fantastically in the last year, and it's absolutely essential that we keep them well, we look after them, we focus on all the things they need to continue delivering for our population and continue to provide that top class healthcare that we're used to. Next slide, please. In terms of the interim arrangements, I won't focus on this too much, but just to say that we're all incredibly saddened that Len's moving on. He has been an inspirational leader. It's very big boots to fill, even in an interim role, but I'll do my best in that role. To enable me to take over from Len for some months when he leaves at the end of September, he and I are working very closely together right now, and we have been for some months in terms of that transition, and we will be increasing that co-working over August and September to ensure I've been exposed to all of the relevant areas that I'd need to be able to hold that interim role successfully. The appointment process is going ahead in September, and a new person would be able to start sometime after that, of course. And one of the key components of my role in the interim position is to ensure that that individual lands successfully in the organisation at the right time. To free up my time to do that, Professor Meriel Jenny is stepping into an interim MD role, and she has been supported in that to free up her time to deliver that by Associate Medical Directors Richard Scone, Raj Krishnan and Rachel Lee, who have also freed up their time to support Meriel. Next slide, please. In terms of our strategy, and of course, the Shaping Our Future Wellbeing Strategy has been mentioned many times. When it was first written 5-6 years ago, no one knew that there was going to be a COVID pandemic. And there has therefore, of course, been a need to recheck the strategy, to go back to it and say, is the strategy fit for purpose in a post-COVID world as well as it was in a pre-one? The good news is it absolutely is, and the components of the strategy that are in place are exactly the ones that we need to deal with in a post-COVID world. are also exactly the components that we need to deliver that transformation Steve was talking about in terms of the reset and recovery plans. So there has not been a need to change our strategic aspiration and strategic plan over the lifetime of our Shaping Our Future Wellbeing strategy. It remains fit for purpose. That doesn't negate the need to continue to provide for the new health challenges that we face in terms of reset and recovery, but it does mean that the work we have been doing is absolutely aligned with that. There is a bit of a need, though, to consider whether our organisational structure is quite right post-COVID. As people know, we're currently running a clinical board-based structure, but alongside that, we have a site-based structure. And there might be a point in due course when we need to revisit that a bit. And if we did so, just to assure everyone that any discussion about structure and any change in the organisational structure would be undertaken with full discussion with the board, with staff associations, with other key stakeholders to make sure the future structure was absolutely fit for purpose for everyone's requirements of it. Thanks, Raj. Would you mind going on to the next slide? In terms of the strategy, I just was going to touch upon some of the headline components of the overarching Shaping Our Future Wellbeing strategy. We've already alluded to the work that's gone into the Shaping Our Future clinical services component. People are aware this is the bit which says, how will we treat people once they become unwell? What are the components of our services that we need? What pathways will they go through? What are the right environments for those individuals to be managed in? So it's key. It's absolutely bedrock towards the overarching Shaping Our Future Wellbeing strategy. That has to be built with full, has to be built from the ground up. That is about our clinical teams informing us how that should come together as an overarching clinical services plan, and people will know that's exactly what we've been doing with recurrent workshops and future engagement and workshop plans to get that exactly right. But of course, there's two or three other main aspirations of our Shaping Our Future Wellbeing plan. First one is, of course, to only utilise hospital resources when they're absolutely needed, and to prevent over-reliance on hospital resources when people can be managed closer to home. In that context, the Shaping Our Future Community Care strategy is key, especially in terms of delivery of diagnostic services closer to people's home, and indeed treatment options closer to people's home, and without doubt liaison, close work with our colleagues in primary care. Shaping Our Future Hospitals, we can't do any of this in the very long term without a change in our hospital configuration and resource. People know that, and that forms a major component, of course, of Shaping Our Future Wellbeing, and it's essential we get that right size it, but not just right size it, but also have the right utility, the right interaction with other stakeholders, the health science hub, work with Cardiff University. All of those things are absolutely key in terms of that Shaping Our Future Hospitals plan. And finally, of course, Shaping Our Future Population Health, which is another major aspiration of the overarching strategy. We need to move healthcare upstream. We need to prevent illness, keep people well, rather than treat people when they become unwell. And we have a fantastic suite of portfolio of works in the Shaping Our Future Population Health Plan as that comes together. So a key component, and which continues. So I'll move on to the next slide then, please. Thanks, Raj. So look, I think in terms of COVID, what I'd say is we're going to be living with COVID. I think it's likely that COVID will be around for the rest of all of our lifetimes, especially with the emergence of variants. So it's a new healthcare landscape in which we're going to have to work. To deliver our non-COVID healthcare in that environment, we need extensive public health support. You know, the vaccination programme in the UK, in Wales and in Cardiff has been absolutely phenomenal, world leading, and we should thank our colleagues to the bottom of our hearts who have delivered that for us, because that is what is going to get us out of this difficult situation, as people know. But we will need an ongoing vaccination programme, so none of these things can ultimately step down. The reset and recovery plan has to live alongside a flexible COVID response plan. but as Steve's alluded to and we've already stated, and absolutely key, that we deliver against that for the benefit of our population. And I could go on with the fantastic work being undertaken in primary care and community providers. Mental health isn't on this list, but that's another key area where post-COVID there's been a significant change in provision of service, need to interact with other partners and so forth. So absolutely key. Can I move us on, please, to the next slide? Thanks. In terms of the details of the strategy and the recovery programme, I suspect time will prevent me going into these here, so I won't go through them all. But of course, in terms of the recovery programme, I would just say, I just highlight the fact that it's not all about elective care. There is a very large element of elective care, as we've discussed, and a key determinant of our ability to provide for our population health. But alongside that, we mustn't forget the key changes we need to undertake in recovery for mental health services, for diagnostic services, for the delivery of unscheduled care in a post-COVID environment, and of course, our primary care services and how we support our primary care colleagues to deliver in what is a very challenging circumstance for them at the moment. Could we move on, please? Thanks. Now, if I had one slide that I wanted to focus on in the whole of this presentation, I think it would be this one. And the headline says it all. Our staff are our most precious asset. We have a tired workforce. They have performed beyond any expectation. We recognise the toll that COVID has already taken on our staff's physical and mental well-being. We've invested heavily through our workforce support and the health charity in providing a range of self-help and more dedicated clinical psychological support from our wellbeing service, but that cannot stop, and it has to improve and it has to evolve, and we have to really communicate and signpost our staff to that service when they need it. Again, I would just make a comment about the diversity of our workforce and our need to be an inclusive employer, and all the work that all of us are doing across the board to deliver against that very key aspiration. It's the values and behaviours, I think, that we undertake that will help us to retain our staff and to recruit them and to put them in a position to come to work and work well, with taking into account their own personal well-being. So absolutely key slide for me. Many thanks, Raj. Next slide. But of course, it's all about our patients. And looking forward, we have to continue to engage with our patients. You know, the public and our patients have been fantastic in COVID. Their degree of understanding of the pressures that our staff have been under has been huge. And we know that, and Len alluded to that in his discussion about all the different things they've done. But there has to be a limit to how much we ask our patients to tolerate, and there will be a point at which we cannot continue to accept that backlog that we've previously alluded to, and we have to transform our services to enable people to receive care in a way which works around the constraints that COVID has put into our system. To do that, we've got to listen to our patients. We have to engage with them, and we have to involve them in the future of our service design, and that is exactly what we're doing. And that will enable us to respond to their needs, both individually and in terms of the health of the population. Thanks. Could you mind? Would you go on to the next slide, please, Raj? So look, all of this. So what does it all add up to? It adds up to a combination, in my mind, of business as usual, of continuity. You know, I cannot pretend for 1 second that that we don't face huge challenges, and I likewise can't pretend that the loss of our current CEO adds to that. But I think our ambitious plans, and with the resilience of our leadership team, and with the recent recovery plans we've heard about, sticking to our strategic aspirations, then we can deliver, and to do so would be absolutely the right thing. But we can't do it alone. And what this slide tells us is about the way that we work in partnership. You know, I'm not going to go through all of the people on this slide, but you know, the key partners are our patients, their carers, their families, our staff and staff side, but also, of course, the local authorities, universities, third sector, CHC and so on. So look, we're part of a big team, a big organisational team, and we need to play our part in that team. And I know that we will, and we have, and certainly even in my time in the Health Board, which is now over 2 years actually, I've seen those partnerships go from strength to strength, and so which is, I think, down to the hard work of all of the people on this AGM call, but also, of course, all of our staff and stakeholder colleagues. So where will I finish? Next slide, please, Raj, which is the last one. Where I'll finish is saying that we're in no doubt about the scale of the challenge ahead. We're committed to our public service as a group of leaders. We're committed to our patients, and we're committed to our staff. The transition both to a post-COVID environment and to a new CEO environment is likely to be a bit bumpy, but we believe that we can deliver against that. We believe that the spirit that carried us through COVID will help. We believe that we've got that resilience, and we're putting the plans together to enable us to get through this next period. And so thank you from me to everyone who's contributed to that so far, and for all the support I've had in looking forward to the interim phase that supports Len after his leaving, and for all the support that I know Steve's had in terms of the operational plan, that Abby and the team have had in terms of delivering against the strategy. So that's all I was going to say, Jan. If I can finish up at that point and just and thank everyone again.
Thank you, Stu. A really helpful presentation. And I appreciate the honesty and frankness with which you've painted the picture going forward. There are some certain steep hills for us to climb. We know that, but we are prepared to take them on. Your focus on staff, patients and partnership working is particularly valid, I think. And as a board, we will build on those as we go forward. Very grateful for the presentation. Thank you, Stu. That brings us to the end of our AGM for this year. As we've heard today, the past 12 months have been incredibly busy and challenging for all of us. As we move into a period of fewer COVID-related restrictions, we need to take careful responsibility to keep our staff, patients and ourselves safe during the coming months. On behalf of the board, I want to thank you all for joining us today and for your amazing support throughout the year. So please stay safe. Thank you very much. Diolch yn fawr and hwyl fawr. Thanks, everyone. You can sign off now.